Hi, this is Sangeeta Dhavala, now going to take you through a topic dealing with arthritis. What is arthritis? Arthritis is a disease that is characterized by chronic musculoskeletal pain and is also characterized by inflammations in the joints. Have you any time seen a person who reminds you of a pendulum? He walks as if he is moving in a pendulum fashion. Why is it so? Why is he or she unable to walk in the normal regular style like he used to do earlier? It is because his joints or her joints have been affected badly and he or she has been diagnosed with a condition called arthritis. Arthritis is found to be more prevalent in women than in men, and the ratio is somewhat like 3:1. For every 3 women, you can find a singular case in men. This disease is characterized by remission and exacerbation, in the sense that the person may experience pain for a certain period of time and then for a certain period of time do not experience any pain at all. So, this lack of pain season and intense pain season keep alternating, and how frequently this keeps alternating is anybody's guess. So, you could say pain is the most characteristic feature, the most common feature and the most troublesome feature of arthritis. Almost all the people who have been diagnosed with arthritis will tell you that they experience pain from moderate to severe levels. There is a relation that exists between the psychosocial factors and pain. The psychosocial factors influence the perception of pain. The presence of pain in turn has an effect on the psychological well-being of the person. For instance, when your mood is fine, you tend to focus your attention on better things than on pain. But when your mood is bad, all your attention is drawn towards the pain that you are experiencing because of arthritis. As you can see, there is a strong relationship between your state of mind, the psychological state of mind and also the emotional state of mind of the person who is suffering from arthritis. What are the various signs and symptoms of this disease? Let us take a look. The onset of arthritis can definitely be dangerous and sudden. There is inflammation in the joints which is very painful. You may initially neglect this condition thinking something has gone wrong when you were walking or when you were running or playing, but there is something serious brewing up. There is anorexia, there is weight loss and low grade fever also as a few signs that you need to be alert about when the disease actually starts setting in. For some individuals, it is just a bout of one experience with the disorder, but there are quite a number of people who face a recurrence of the same kind of symptoms, and for them it is a chronic disorder and a progressive one also. Progressive one in the sense it might start off with a mild pain, but definitely become worse and would take him to the extent of getting a surgery done. Joint involvement is usually characterized by swelling, pain, redness, warmth and tenderness. Joints of the hands and feet are often affected very early in the condition. As the disease progresses, the number of joints that are affected will take their own course, and each one of them have a chance that they also develop an inflammation and pain from there on. What are the risk factors involved with arthritis? Who has the highest chance of getting arthritis? Needless to say, it is genetics and the family history that pushes the person to a great amount of risk. There are certain types of arthritis that are highly prevalent in some families. So, when the parent or a sibling is already suffering from arthritis, there is high likeliness that this person too gets the disease at a later stage or in the recent times. Age. Older the generation, older the person, the risk of getting rheumatoid arthritis is high. So, the risk keeps increasing with age. Sex. Women are more prone to getting arthritis than men. Past history or injury to the joint also exposes the person to greater risk of getting arthritis. You must have played some time during in your lifetime when you injured your joint. So, this person is more prone to the risk of developing arthritis at a later point in time. Obesity, lack of activity, sedentary work styles and lack of physical exercise also will push the person towards higher weight on the weighing scale, then push him into the obese category, and you will see that the person we were talking about who moves like a pendulum when he is walking has got it mainly because of being obese and overweight. How can the high amounts of risk of getting arthritis be reduced? What can you do? Basically bring about a lot of lifestyle changes, and if you find that there is a strong family history, you get periodic checkup. You have to exercise regularly so that you keep arthritis at bay. When you exercise and manage your weight to a great extent, you can definitely avoid falling prey to this disease that might cripple you to perform a whole lot of activities. Of course, pain will become an integral part for these patients, and how can they tackle pain is with the help of these icing pads or the heating pads that have the ability to absorb pain from the joints. What can the older patients do? When they are unable to walk because of pain in their joints, they can take the help of these assistive devices with whose help they can walk from one place to another. We do not say they can walk effortlessly. The pain is definitely going to be there, but only thing, the amount of pressure that you are applying on your legs will be transferred to a certain extent onto the assistive device. What is the cause of arthritis? There are quite a number of predisposing factors that will influence to develop arthritis, and they are biological influences and psychosocial influences. As we saw earlier, heredity plays an important role in a person falling prey to arthritis. There is a serum protein in the rheumatoid factor which is found in at least half of the people with arthritis, and frequently this is present in close relatives too. So, this is an inherited characteristic which increases the vulnerability of a person to fall prey to arthritis. Another theory states that arthritis is a condition that is caused because of a dysfunctional immune mechanism that is initiated by an infectious process, although the causative agent is not identified. We saw that the biological influence is basically heredity. The psychological influence, of course, is a somewhat different scenario. Arthritis is a common sight in those people who are masochistic, who are self-conscious, who are self-sacrificing, who are conforming, who are perfectionistic, and who are inhibited. These people at some point in time suppress their anger to a great extent. The female sufferers are found to be tense most of the time, nervous, worried, moody, and also depressed, and they typically had mothers whom they felt rejected them, and the fathers were generally very strict with these people. So, it is these factors, the factors that you find in men are different and the factors that you find in women are different, that make them more vulnerable towards getting arthritis at any stage in their lives. Almost all types of arthritis call for clever pain management, because this is one major symptom that each one of the patients will suffer from. There is fatigue also that sets in, there is stiffness of the joints, and quite a number of other physical limitations also that need to be faced by the patients. Now, how successfully they are able to manage these conditions will define how successfully they will carry on other activities in their lives. Arthritis is found to have a considerable amount of influence on the work that the person does, on his family life, and also on the leisure activities that he takes up. As a result, you could see that there are a lot of relationships at stake when a person is diagnosed with arthritis. Leave alone the medical care. There is a lot of psychological activity that takes place because of his condition. There is a lot of social activities that come to a halt because of his condition. All of us very well know we are social beings. Man is a social animal. There are certain amount of responsibilities that he need to fulfill for smooth running of his own job as well as the routine of his family. He needs to take care of a whole lot of activities in his day-to-day life. So, when there is persistent pain, it is definitely going to act as a hindrance in the speed with which he is going to perform each one of these activities. As a result, there is a lot of pressure on his psychological well-being and social well-being also. When he is able to contribute positively towards the functioning of the family, he is bound to feel good about it. Feeling good means a good psychological state of mind, but because of the pain, he is unable to participate in the family activities with the same gusto as he used to do earlier. Because of the pain, he is unable to take part actively in the social activities. As a result, you see that his psychological well-being is disturbed and his social well-being and emotional well-being are also considerably disturbed. People who had high levels of pain experienced a lot of psychological distress. Their self-efficacy became poor and very soon they became unemployed. There is also evidence that suggested that emotionally traumatic life events like loss of a key person in the family also had a considerable amount of influence on the symptoms that were experienced by the patient. Therefore, we can say that it is the emotional state of mind that is going to act and intensify the pain that is being experienced by the person suffering from arthritis. As we mentioned earlier, pain has an impact on the way a person works, on his family life and also on leisure. How it affects his work, let us take a look. Regardless of whether you are suffering from a chronic illness or no, if you are employed, there is bound to be good self-worth. You feel happy, you feel good about your own self. But when such a chronic illness like arthritis sets in and there is no possible cure, you will find that it will impede or act as an impediment in your levels of job satisfaction. When the levels of job satisfaction are low, there definitely is going to be a drop in your productivity levels. And when the productivity levels are low, there is always a risk for your own job and very soon you may find your way out of the job. At times, the energy that is consumed at the workplace also has an effect on the health status of the person. Just imagine a person having arthritis has to do a job that calls for his movement in the office from one place to another. How long will he be able to work actively? Probably when the moment he comes to the office in the morning, he will be energetic, he will feel energetic and be able to deliver work at a regular pace. But as the day progresses, his energy levels dip and he will find himself sitting comfortably on a chair, passing on instructions to the others to do this task from here to there. There is always a risk of job loss because of arthritis, and as a result there is reduced life satisfaction, and from reduced life satisfaction there is greater depression, and once again when you are depressed you are going to perceive more pain. How is pain going to affect family life and relationships? We have seen that pain definitely has a positive interference, or it definitely interferes with the way a person can work. Similarly, it is also found that it has an interference in the way relationships can be conducted. For instance, as a parent, you will have to do your own set of duties that are chalked out for you. You will probably have to take your child to the school, drop him there and probably pick him up back to home. But because of this condition, the amount of time that you would take to perform these activities also would increase. As a result, what would happen? This job is passed on to your wife, or rather a spouse. Managing household becomes difficult. Your husband or spouse has to be more understanding to your condition, probably share half or more of your responsibilities to see that all the tasks are done on time. As a result, there is argument between the couple and a slight amount of strain that is experienced in the relationships. Parents who were diagnosed with arthritis have reported that they find taking care of their children a bit strenuous. It is not that they do not want to take care of their children, but it is because of the physical incapacity caused by the pain that they are unable to work with such kind of agility that they had earlier. It is the mental status of the patient that has been proved to have a lot of bearing on the kind of well-being of the person. Social support from the members of the family also has been found to good performance of the person, not only in the household work but also in parenting also. Social support from the members of the family was found to contribute positively to the person performing his household duties as well as parenting duties. Another aspect that pain influences is that of leisure. We find that people suffering from arthritis engage in fewer leisure activities. One probable reason could be that these people are not aware of the various leisure possibilities that they can engage in. People who are not that highly educated are not aware of ways in which they can spend their time in productive leisure activities. At the same time, leisure is also considered to be discretionary by nature when a person juggles between the demands of his day-to-day life and his free time. This person who is suffering from arthritis would first prefer to fulfill his obligatory requirements, obligatory responsibilities, and then perhaps engage in some kind of a leisure activity. However, one main thing that we can notice is that when there is pain, there is physical limitation. It becomes extremely difficult to engage in any kind of recreational activity. What does recreational activity mean? It gives your mind a lot of freshness. For that, you need to engage in some kind of a sport. But what happens? Or you may go out for a walk with a bunch of your friends. But what happens when you are diagnosed with arthritis? All these come to a standstill. You will not be able to engage in these activities any further. So, you will have to choose for options other than this in order to make good use of your leisure time. When there is a decline in such activities, there is bound to be a lot of dissatisfaction and depression. Imagine going for a walk will fill you with a lot of sense of freshness. You meet so many people, you exchange a lot of news, sometimes gossip, and you generally tend to look forward for that time of the day. But because of the pain, you are stopped from meeting all these people. So, as a result, you will slowly feel you are out of the group. It is just a mere physical condition that has brought about a lot of psychological unrest in your mind. Leisure, therefore, is considered to play a very important role in keeping the psychological balance of a person intact. How can arthritis be managed? So, as a part of management of arthritis, we see that there are different treatment procedures: the pharmacological treatment, the psychological treatment, the family therapy, the cognitive behavior therapy. All these things working towards the betterment of the condition of the arthritis patient. The goals of therapy for rheumatoid arthritis are to relieve the discomfort and also pain to a great extent. The main focus is to achieve remission. Remission is a stage when the person does not experience pain, when the person ceases to experience pain. When there is exacerbation, there is intensified pain that the patient experiences. What is the pharmacological treatment that is offered to the patients suffering from arthritis? Aspirin is considered to be cornerstone of drug therapy for a person who is suffering from arthritis. When it is given in large doses, it has high anti-inflammatory action. It is also considered to be an analgesic and an antipyretic. 4 grams per day is the permitted dose, and anything excess might have its own side effects at a later point in time. Diazepam also is considered to be an effective pharmacological treatment, as this drug is going to help the person deal with his anxiety levels also. There are non-steroidal anti-inflammatory drugs that are prescribed by the doctors at times when the intensity of the pain is very high. There are a lot of anti-rheumatic agents that can be used by the patients in order to relieve the symptom of pain. There are a whole lot of corticosteroids that can be administered, but there is a fear of getting addicted to such kind of steroids which may prove fatal in the long term, or rather than proving fatal, they will have adverse effects on the other organs of the body. Apart from the pharmacological treatment, we have surgical treatments too to tackle arthritis. There is synovectomy that is performed to relieve pain and maintain muscle as well as joint balance. There is joint fusion that is provided to stabilize the joints and also decrease the deformities. There is the spinal fusion also that can be performed in order to treat subluxation. Then we have the most popular overall joint replacement therapy, which is considered by many people who are suffering from severe deformities. This kind of a surgery will help the person come out of the intense pain that has been bothering him since a very long time. This kind of a surgery will allow the person to increase his motion capacity, and he will be able to move quickly from one place to another post surgery once the necessary care has been taken. After the pharmacological treatment, the surgical treatment, we have the psychological treatment. Psychotherapy can definitely help the patient who is suffering from arthritis. The person can be made to deal with his condition more effectively when it is identified at an early stage. The person's reaction to the diagnosis of arthritis can be different. It all depends of the level of inactivity that he is experiencing. When he is in the early stages itself, he will probably be in a better frame of mind to take the diagnosis. But if the levels of inactivity are high, the kind of effect that it might have on his reaction to the diagnosis is going to be severe. He should understand that there are a lot of lifestyle changes that he needs to incorporate in order to function normally. Initially, there may be denial of illness when the symptoms are still at the early stage, but later on, as this arthritis is progressive, when the patient experiences some other severity in the symptoms, he will then realize that he cannot come out of the situation, but learn to manage it with the kind of treatment options that are available for him. The clients should be encouraged to act as much independently as possible. They should refrain from becoming a dependent. Rather than stopping to walk completely, they can take the help of some other devices and induce some kind of a motion. The focus on cure should be deflected to a focus on control of the disease. cure at this stage cannot be possible, but there can be control definitely achieved when the right habits and the right lifestyle changes are made. There are a whole lot of psychosocial approaches that will help a person in dealing with arthritis. There are educational programs that elucidate on the various aspects of arthritis. They will provide a lot of information about what arthritis is and how it can be managed, how it can be controlled. There are a lot of coping skills taught. There is cognitive behavior therapy administered to the patients, and all these therapies, the introduction to them can also be or should also be given to the people who are very closely associated with the patient. The main focus, of course, has to be on providing the information that is necessary for understanding the condition, and then information also has to be given regarding the approach that the patient is using. The person has to be taught or explained what he can expect out of a particular treatment approach. The same instructions also need to be shared with the close relative of the person, or rather the patient, because it is this close relative of his who is going to provide him with all the physical support and the emotional support that is required during coping with arthritis. All the efforts are centered towards decreasing the level of helplessness that the person with arthritis is experiencing. Majority of the people who have fallen prey to arthritis are making use of the medical resources that are available to them, but one glaring mistake they are committing is that they are failing to recognize the importance of the psychological treatment that can bring about to the quality of their lives. There is a community based program called the Arthritis Self-Management Program, which provides a lot of education intervention to the patients as well as to the people who are closely associated with the patient. It is a typically 6-week program wherein the patient is exposed to the various parameters that are involved with the condition. He is made familiar with the various complications that might set in, and he is also made fully aware of the kind of treatment options that are available for him. These education programs definitely capacitate the patient to tackle his condition in a better manner. They will definitely fill him with a renewed sense of confidence, and he will start feeling independent and cease to be a dependent on someone. The cognitive behavior therapy includes quite a number of exercises which can be conducted individually.